This cow was unable to walk properly due to locking of the hind limb. This condition is known as upward fixation of the patella, a common orthopedic problem in cattle. In today's video, we will demonstrate in diagnosis, causes, surgical treatment, and recovery. Upward fixation of the patella occurs when the patella or kneecap becomes locked over the medial trochlear ribs of the femur. As a result, the hind limb remained extended and the animal cannot flex the leg normally. Common causes include weakness of ligament, poor muscle tone, mineral deficiency, hereditary predisposition, rapid growth, and slippery floor. Affected cattle usually show stiffness of the hind limb, dragging of the leg, difficulty in walking, and sudden locking of the limb in extension. In chronic cases, the animal may lose body condition due to difficulty in movement and feeding. Diagnosis is mainly based on clinical sign and gait examination. The characteristics locking of the hind limb confirm the condition. Since conservative treatment was not effective in this case, surgical correction was planned. The procedure performed is called medial patellar desmotomy. First, the animal is restrained properly in standing position. The surgical site over the medial patellar ligament is shaved and disinfected using antiseptic solution. Local anesthesia is administered around the ligament to ensure pain-free surgery. After proper preparation, the medial patellar ligament is identified carefully by palpation. A small step incision is made over the ligament using a surgical blade. Then the ligament of medial patella is isolated and transected carefully. Once the ligament is cut, the patella is released immediately from the locked position. This restores normal movement of the stifle joint and allow proper flexion of the limb. The surgical wound is cleaned properly after completion of the procedure. Immediately after surgery, the animal show improvement